All right, good morning, everyone. Happy Monday. My name is Sarah Story. I will be your host for today's presentation. We're going to go ahead and get started. So today we're going to be covering the SEB annual pre-open enrollment. We want to thank you for participating in today's webinar. And just a reminder that all attendees will be muted, so we ask that you do not unmute yourself if the program allows you to. And unfortunately, we will not be able to assist with technical issues, and we do apologize if they keep you from participating. But as a reminder that this webinar will be recorded and posted to the BA website. Today we're going to be covering a lot of different information, and we do have over 400 participants registered. So most likely we won't be able to take any questions today during the webinar, but we will reply later this week to anything that we are not able to get to during the webinar today. There is a good chance that the presentation may go longer than 1 hour because of all of the content we will be covering. So if those of you are not able to stay on after 11 o'clock, just a reminder that this webinar will be recorded and posted. We do ask you to please limit your question to today's topic of open enrollment. Other questions and issues should be addressed via Fuse. We are very busy working all of the fuses that we have been receiving, but we do appreciate your patience while we work through them. And then just a reminder that we will be offering a webinar on October 23rd, and that's going to be covering the SEBB My Account open enrollment functionality. So just a reminder about that. And as I said before, please use the questions features to go ahead and send in any questions. And if we're not able to get through to those, we will submit them later on this week and reply to you. With that being said, I'm going to go ahead and hand it over to Mr. Robert Blyden.
Good morning, everyone. Happy Monday. We haven't done a webinar on a Monday in a long time, or that I can remember, for a while. So happy Monday. It is sunny outside. My name is Rob Blyden, and I will be your presenter today. Myself and Sarah are both benefit marketing reps with the Healthcare Authority, and we probably communicated with you through email or through Fuse. So let's get started. So welcome to the SEBB 2021 pre-annual open enrollment webinar. So a few things on our list that we're going to cover today. We're going to provide you with information about this 2021 annual open enrollment that's coming up. And also we're going to talk about some 2021 SEBB premiums that have changed or may have stayed the same. Also the 2021 SEBB program changes that are happening. We're also going to talk about things you can do and things you can't do when enrolling in a medical FSA and DCAP. And then that one-time opportunity to enroll in supplemental LTD. We're also going to share information on what you can do and what you can't do in SEBB My Account. And as open enrollment starts to approach, I know some of your employees are going to have issues trying to get back into their accounts if they haven't gotten into their SEBB My Account since the initial open enrollment last year. Also, we're going to provide you with contact information on if your employees have questions, who do they contact? Do they contact the plan? Do they contact the benefit administrator, and so on? And then as usual, we're going to share some reminders, tips, and resources with you to help you in your position as a benefit administrator. So let's talk about some of the SEBB program communications that's out or coming out. So on September 25th, the annual open enrollment information is available on the SEBB open enrollment webpage. And we're going to share that link in this webinar. So that happened last Friday. I was on this website and it's working and it's up and running. Also on September 25th, the virtual benefit fair is now open 24 hours a day, 7 days a week, day and night. Your employees can now go on here and use a virtual benefit fair through the end of open enrollment, which is November 23rd. And just a reminder that we will not be offering any in-person benefit fairs this year because of COVID-19. So the virtual benefit fair is what we have, and that's what we're offering to your employees. So on October 6th, the SEBB program will mail and email the Intercom newsletter to employees and those who subscribe to the email subscription. And then on October 15th, you can join us on HCA's Facebook for a live event at 4 p.m. And we will show you where you can find that link That's also on the SEBB Open Enrollment webpage. Also, the SEBB program will provide email messages to forward to your employees. These are sent through Gov Delivery before, throughout, and definitely as open enrollment starts to end, they'll start pushing out those email messages. Again, you must be registered in Gov Delivery to receive these email messages. So you'll be getting a lot of email messages during open enrollment and prior to open enrollment. So important dates that you might want to write down on your calendar is October 26th is the beginning of the annual open enrollment period for 2021. November 23rd is the last day to enroll or make any changes to your SEBB benefits. And for those employees that have a medical effective date between January and September 2020, they do have a deadline to receive that $125 wellness incentive, which is November 30th. And for those employees that have a medical effective date between October and December of this year, they also have a deadline. So we're talking about those new employees that are just enrolling into SEBB benefits with an effective date between October and December. Their deadline for the $125 wellness incentive is December 31st. And lastly, January 1st of 2021 starts the new plan year. Those new elections are now effective. So employees can also find information on that website and also in the October edition of the newsletter. Again, this will be mailed out or emailed to those that subscribed for it October 6th. This is the only 2021 open enrollment notice that employees will receive. Again, you can find a lot of information that's available on the SEBB program website at this link right here, beginning as of last Friday. So this newsletter that's coming out has important information on annual open enrollment, important dates that you can see on the photo there. Also, access to the virtual benefit fair, how you can get to that, and then changes to the health plan and the premiums for 2021. So you hear this throughout the webinar that the 2021 SEBB annual open enrollment period is from October 26th through November 23rd, 2020. Those changes or elections that you make will be effective January 1st of 2021. And again, due to COVID-19, we will not be offering in-person benefit fairs. So when you go to the school employees website, it looks like this, and you click on school employees, it'll bring you to this web page right here on the left. If you click on open enrollment right there, it'll bring you to this open enrollment, SEBB open enrollment web page. And again, on this page, you have all kinds of things. It states right there, 2021 benefits and plan changes, premium and benefit information. You have access to open enrollment, the open enrollment webinars that those carriers are going to be providing, to include the virtual benefit fair link that's on the bottom of this page here. And also on this page, you can click on the link to join that Facebook Live event on October 15th. Here's the link down below. So the virtual benefit fair, again, is open 24/7. It's an online virtual benefit fair that provides a lot of resources, benefit options, link to videos. It compares plans. It has all the upcoming webinars, downloadable content, and you can access this on your computer, tablet, or smartphone. You can hear the introduction by our director there. And all the links on the left-hand side of that page you can click on to get more information on medical benefits, dental benefits, dependent care, the medical FSA, all that information. So Alex, which will be available on October 1st, is an interactive benefit advisor. It helps employees understand their benefits, and it also guides and suggests health plans. So for those employees that are coming on board to SEBB program this year, that benefit information will be available to them until the end of December. So for employees that want to know about benefit information next year, that'll be available also starting October 1st. So what can employees do during open enrollment? First of all, employees are not required to make any changes to their health plans during open enrollment. If they're satisfied with their plans that they're currently in, they don't have to do anything unless their health plan is no longer available. Keep in mind, those employees who choose not to make any changes will remain enrolled in their current plans for 2021. Also, those employees that are covering a spouse or state registered domestic partner for 2021 medical coverage may need to reattest to the spouse or state registered domestic partner surcharge. And those employees that choose to participate must enroll or re-enroll in a medical FSA or DCAP, and they must do this every year during annual open enrollment. So what else can employees do during open enrollment? Well, during open enrollment, employees can change their medical, dental, and vision plans. They can also add eligible dependents. We do require dependent verification documents. And there's a list of that valid dependent verification documents that are available on the BA website under Policy 31-1. They can remove dependents from medical, dental, vision plans. And they can waive medical coverage if they're enrolled in an other employer-based group medical coverage, a TRICARE plan, or Medicare. Employees may not waive dental or vision. They can also enroll after waiving medical coverage. This does not require proof of other coverage. They can attest or reattest to the spouse or state registered domestic partner premium surcharge if they're required to. They can enroll or re-enroll in a medical FSA or the DCAP every year. Enrollment does not automatically continue from year to year. So if they have a medical FSA now and they wish to have one in 2021, they must re-enroll in the medical FSA. So employees may enroll in or make changes at any time to their supplemental life, accidental death and dismemberment, and long-term disability insurance. Insurance carrier approval and evidence of insurability may be required. They can subscribe to receive the SEBB program emails. All they have to do is go into SEBB My Account, click on their profile, contact information, and then go ahead and add your email address. Go to the coverage summary, click on the checkbox that you wish to receive email notifications. And instead of getting a paper form, they'll get that, that newsletter, the October newsletter, through an email. So let's talk about the 2021 SEBB premiums. So this is a monthly medical premiums for Kaiser Permanente. So it shows all the different plans down there. You have the base rate of 1,000, and that base rate will maintain until June 30th. So you have different columns or different tiers. You have the employee and spouse, the employee and children, or you have the full family rate. So again, these monthly premiums, I showed you what it was in 2020, and everything in purple are the new 2021 monthly premiums.
Hey, Robert.
Yes.
Just really quick before we continue, I did see some questions that I did want to address since we're getting a few of them. That employees who need to reattest to the spousal surcharge, I just want to clear up that they will get a letter from SEBB stating that they need to do so. So they will receive a letter from SEBB stating that they have to reattest. That's how they're going to know. So I just wanted to clear that up for those BAs who are asking.
Yeah, I'm going to cover more information on the spouse or state registered domestic partner and how do they know if they need to reattest. And you're right, Sarah, they are going to receive a letter from the SEBB program. Also on October 26th, I'll cover this in a slide a little later. that they can go into SEBB My Account and click on the Attestation tab to find that out.
All right, so stay tuned for more info.
So for just a single employee under Kaiser Permanente Northwest 1, for 2020, they were paying a monthly premium of $28, which increased starting January 1st to $39. So they had that $11 increase. And for the Core 1, they were paying $26, which increased to $32. And also for the Sound Choice, they were paying $86 for 2021. That increased $3 to $89. And for the Access PPO3, they were paying $348. Now it increased to $438. So for Premier Blue Cross in 2020, for the high PPO, they were paying $70, and now it increased $6 to $76 for 2021. And for the standard PPO, they were paying $39, which increased $10 to $49 for January 2021. They'll start paying $49. So there is a little slight increase with Kaiser and Premier Blue Cross. So for the UMP plans, it looks like everything is maintaining at the same monthly premiums that they paid for 2020. There are no changes. So when it comes to the tobacco use premium surcharge, that will remain at $25 per account per month, in addition to their monthly medical premiums, regardless of the number of tobacco users enrolled on their account. Again, this tobacco use premium surcharge, they can attest anytime throughout the year. They don't have to wait till annual open enrollment. And just a reminder, there's no need to reattest to the tobacco use premium surcharge unless there is a change. So for the spouse and state registered domestic partner premium surcharge, that will also remain at $50 per month, in addition to the monthly medical premiums. Employees may have to reattest to this premium surcharge during annual open enrollment. And again, like Sarah and I stated earlier, the SEBB program will mail letters to those employees who need to reattest. Also, employees can check to see if they're required to retest using SEBB My Account starting October 26. Just go ahead and go into SEBB My Account, click on Attestation tab, and follow the instructions. So how do I reattest? So employees who must reattest can do so using SEBB My Account, or they can submit that paper form to their benefit administrator. They can do this during annual open enrollment between October 26th and November 23rd. Or they can do this during this change period of November 24th till the end of December. So what happens when employees don't reattest during this period between October 26th and December 31st? They will all automatically be defaulted to incur the $50 monthly surcharge, and this will be effective January 1st, 2021. Surcharge does not apply if you are not enrolling in medical. If you're waiving your medical, then that surcharge does not apply. So let's talk about some of the SEBB program changes for 2021. So there was a notice that was sent out on July 31st, and you can find this on the BA website, this notice here. And it covers all the changes for the SEBB program that happened. So there is a change to the Uniform Medical Plan Plus, and that the Puget Sound High Value Network will add the following counties to its service area: Chelan County and Douglas County. They're also adding the following provider groups to its network effective October 2020: Confluence Health Clinic and Everett Clinic. Premier Blue Cross had a change. They will now be offering the virtual diabetes prevention program starting 2021. And the bariatric surgery. Coverage is limited to in-network and approved facilities, and you will be subject to medical necessity review starting January 1, 2021. If you have any questions at all, please contact Premera at this number right here. And everyone, if you registered, you should have gotten a copy of these slides that were mailed out late Friday evening. So if there's some information and you didn't get a copy of the slides, please let us know and we'll be more than happy to send you a copy of the slides. There is a hearing change for all SEBB medical plans. We'll cover one hearing instrument per year every 5 years. So this is covered in full at in-network providers. There's no cost to members. There's no balance billing by providers. And if you're enrolled in a uniform medical plan, high deductible health plan, the deductible must be met first. So there is a live work change. Employees will be able to choose their medical plans based on either the county where they live or the county where they work. Employees must live or work in the medical plan service area to join that plan. So all school employees will be offered a selection of plans based on their county of residence or the county where the school district, charter school, or educational service district is based. There is an exception. The Uniform Medical Plan Plus members must live in the county serviced by the plan. So let's get into dental, vision, life, AD&D, and LTD insurance. So just as a reminder, eligible employees pay no monthly premiums for dental, vision, basic life, basic AD&D, and basic LTD insurance. So when it comes to dental benefits and plans, they're the same dental plans that are available for 2021. The Uniform Dental Plan, Dental Care, and Willamette Dental Group. There are no changes with dental benefits for 2021. And on the bottom down here in blue, it says to call the plan directly to verify the network your dentist participates in. Do not call your dentist and see if they're part of this dental plan. Call the plan directly. So just as a reminder, Delta Care and Willamette Group are both managed care plans. Employees must choose a primary dental provider within that network. These plans will not pay for claims for providers outside of their network. These are managed care plans. So the Uniform Dental Plan is a preferred provider plan. Employees may choose any dental provider and will usually have lower out-of-pocket costs if they see network providers. So this is a reminder. So this is where we had a lot of appeals last year. Delta Dental of Washington administers two plans, the Uniform Dental Plan and Dental Care. So we had a lot of employees that were selecting the wrong plan when they actually wanted the other one. So the network of providers are different. Call the plan directly to verify which network your dentist participates in. We had a lot of appeals in January, February on this. Employees selected the wrong plans. So for the vision plans, it's the same vision plans that are available for 2021. Davis Vision, iMed Vision Care, and MetLife Vision. There are no changes to the iMed and MetLife Vision. But there is a change for Davis Vision. So Davis Vision added a fourth coverage, which includes progressive lens benefit, and it has a $175 copay. Anti-reflective coating benefit that has an $85 copay for its members. So when it comes to supplemental life and AD&D, the rates will remain the same for 2021, and employees' premiums may change if they change age brackets or increase or decrease their coverage for supplemental life insurance. Just as a reminder, employees can log in to view current coverages and update their beneficiary information. Just visit the MetLife My Benefit portal, or they could submit a group term life insurance beneficiary designation form to MetLife. So when it comes to supplemental LTD rates, they also remain the same for 2021. An employee's premiums may change if they change age brackets or if their wages change. So there are a lot of different plans that employees can pick from. So this is one plan that the Uniform Medical Plan offers, and it's the only high deductible health plan that we have with a health savings account. So the health savings account, employers can contribute, their contribution amounts will remain the same for 2021. So for an employee that selects a high deductible health plan with a health savings account, the employer would contribute $31.25 per month for a total of $375 for the year. This hasn't changed from last year. And for a family, the employer will contribute $62.50 per month, total of $750 per year. So the IRS maximum employee contributions amounts for 2021 have changed. For an individual contribution amount, it has increased to $3,600, up $50 from last year, from $3,550. For a family contribution amount, it's increased to $7,200, and it went up $100 from last year. Employees age 55 or older may contribute an additional $1,000 per year. Employees should be submitting that 2021 school employee authorization for payroll deduction to the health savings account form to their BA. As a reminder, all contributions, we're talking about the employer contribution and the employee contribution, as well as that wellness incentive of $125, if they earn that, may not exceed the IRS maximum. Employees changing plans from a high deductible health plan with an HSA to just a traditional plan, they must stop any automatic payroll deductions for their health savings account, and also stop any direct contributions directly to health equity. So let's talk about the medical flexible spending arrangement, better known as the FSA, or the Dependent Care Assistance Program, DCAP. So the contribution limits for a medical FSA, the minimum annual contribution has not changed. It remains at $240. But the maximum annual contribution was increased by $50 and now is $2,750. It went up $50 from last year. For the Dependent Care Assistance Program, it remained the same at $5,000 annually for a single person or married couple filing a joint income tax return, or $2,500 annually for each married participant filing separate income tax returns. So SEBB eligible employees may enroll or re-enroll every year for a medical FSA or DCAP during annual open enrollment to participate, even if the contribution amounts remain the same. Again, this enrollment is not automatic. You must re-enroll every year if you choose to participate in a medical FSA or DCAP. Eligible employees may not enroll in a medical FSA and a high deductible health plan with a health savings account at the same time. If they do that, they will be disenrolled from the medical FSA by December 31st, and they will remain enrolled in a high deductible health plan with a health savings account. Eligible employees may not enroll or re-enroll in a medical FSA if the employee or the spouse or state registered domestic partner is enrolled in a high deductible health plan for 2021. They may enroll in a DCAP, and they may not enroll or re-enroll in a medical FSA if the employee changes to a high deductible health plan for 2021. So there are deadlines, and we wanted to remind you of this as we're coming to the end of this year. So current members do have deadlines. For a DCAP, all expenses must be incurred by December 31st. For a medical FSA, all expenses must be incurred through March 15th. So they have that 2.5 month grace period for a medical FSA, not a DCAP. Employees must submit all claims for reimbursement by March 31st, 2021. And we're talking about both the medical FSA and the DCAP. Funds not claimed by March 31st cannot be refunded. Any unused balances in those accounts are forfeited to the plan administrator. Employees will not be able to claim unforfeited funds. There is an exception. So for March 2021, deadlines do not apply if an employee has a medical FSA in 2020 and enrolls in a high deductible health plan with a health savings account for 2021. Those employees must use all of their 2020 medical FSA funds and have all their claims paid by the end of December. If not, the employer or the employee cannot contribute to that HSA account until April 1st of 2021. So just a few reminders when it comes to medical FSA and DCAP. Employees must enroll every year for a medical FSA and DCAP. It doesn't roll over automatically. Employees can only enroll during SEBB program's annual open enrollment period while newly eligible during that 31-day period, and if they experience a special open enrollment event during the year. When it comes to a medical FSA, the full amount the employee sets aside is available to spend on January 1st, 2021. Amounts are available only as they are deposited into a DCAP. So if you're at March and you've deposited $150, that is the only amount that's available to the employee. Employees should not submit claims after the services have been provided. Or correction, employees should only submit claims after the services have been provided. So you don't want to submit a claim and you haven't been provided the service yet. So they can enroll on the Navia Benefit Solution website, not on SEBB My Account. Just a reminder, when it comes to the CARES Act, it does remove the requirement to have prescription for over-the-counter drugs in order to use their medical FSA or health savings account funds. Also, menstrual care products can be purchased using their medical FSA funds. There is a debit card that's now available for those members that are enrolled in a DCAP. Members can now use a debit card to pay for child care or elderly care providers rather than submitting a claim and waiting for the reimbursement. So we do have a lot of webinars, and I showed you on the SEBB Open Enrollment webpage that there's a webinar link. This is one of the webinars that's going to be taking place by Navia for the medical FSA and DCAP, and you can register again on that webpage that I showed you earlier. Starting October 26th, you can start signing up for these benefits. Not in SEBB My Account. You must go to the Navia Benefit website. And just as a note, if employees are unable to attend one of the live webinars on these 2 dates for Navia, employees can watch a recorded presentation. You can find out more information on the SEBB Open Enrollment website. So now we're going to jump into the supplemental LTD one-time opportunity to enroll. So this pertains to only employees who have not already enrolled in a supplemental LTD. We're going to talk about why long-term disability insurance, what coverage options are available, and then the supplemental LTD insurance coverage cost. How do I enroll in supplemental LTD? So why do I need disability insurance? So disability insurance provides income replacement when an insured employee experiences a covered illness or injury. Remember that basic employer paid LTD benefit is only a maximum benefit of $400 a month. If you enroll in supplemental LTD, you have a maximum monthly benefit up to $10,000 a month based on your salary. It also helps with financial obligations such as health insurance that health insurance won't cover, such as rent, mortgage, groceries, and other expenses. It also helps employees and protects them from drawing from their savings or retirement plan to cover some of these financial things they need to cover while they're disabled. So this is a chart showing the different LTD coverage options. So for basic, it's 60% of the first $667 up to $400 per month. You still have that 90-day benefit waiting period. But if you enroll in a supplemental LTD, it's 60% of the first $16,667 up to $10,000 per month. So right now, the employer is providing that basic LTD, and they will get up to $400 a month. So this is a comparison here for an employee earning $50,000 a year. Their pre-disability earnings is $4,167 a month. So if you look at the chart here, even though their pre-disability earnings is $4,167 a month, they're only going to get 60% of the first $667, which equals a maximum of $400 a monthly benefit. Not sure how many people can live off of $400 a month when they're disabled, but if you enroll in a supplemental LTD, it's 60% of that first $6,667 up to $10,000 a month. So the $4,167 is well below that $16,000. It's 60% of $4,167, which comes out to $2,500. So that's what that employee would receive if they're disabled on a monthly basis, $2,500. So if you go to the standard website at this link below, it has a calendar that you can put in your numbers. So for this example here, Jeremy, who's at the age of 30, his income is $3,000 a month. Its estimated monthly benefit is $1,800 a month, and he would pay an estimated monthly premium of $5.70. So if he becomes disabled, he's going to get paid that $1,800 a month. Compared to Sue, who's age 55, her income is $5,000 a month, so her estimated monthly benefit is $3,000. She would be paying a monthly premium of $46.50. So some of the advantage of enrolling in a supplemental LTD during open enrollment is the online enrollment is in SEBB My Account. You can do everything in SEBB My Account. There's no evidence of insurability, which we're talking about that proof of good health that's required during the 2020 plan year when enrolling for the first time. So there's no evidence of insurability. And when it comes to pre-existing condition coverage, the coverage for pre-existing conditions will be provided under the continuity of coverage provision for employees who had prior LTD coverage through December 31st, 2019. So that supplemental LTD coverage elected during 2020 annual open enrollment period will be effective January 1st of 2021.
So I guess, Robert, you'd say that during this one-time enrollment opportunity, it would probably be in the employee's best interest to really look into taking out this supplemental LTD coverage because they have
Yeah,
that no evidence of insurability and that pre-existing condition
that's a
coverage.
that's a big one. Evidence of insurability may be required for 2021. Um, and again, they can do it in SEBB My Account. And if you looked at that comparison that I talked about, Sarah, the basic is only up to $400 a month. So if you become disabled, you have the basic LTD, which you're only going to get up to $400 a month.
Yeah, it doesn't cover much.
Yeah, it doesn't cover much. So how do I enroll? During open enrollment, you'll see this notice here. So you'll go to your supplemental tab to enroll in supplemental LTD. Employees will click on the supplemental coverage tab at the top. And down here, all you have to do is click the radio button to enroll in supplemental LTD. Hit submit and you're now enrolled. So how do you know if you're enrolled? It'll look like this. It'll say that you're currently enrolled in supplemental LTD. If for some reason you choose to terminate your enrollment in supplemental LTD, you would go ahead and hit the radio button there and click submit if you wish to terminate your enrollment. For more information, you can see the LTD website for SEBB. Also, eligible employees can enroll in supplemental LTD during open enrollment through using SEBB My Account. Employees may also enroll using the 2021 LTD enrollment/change form. And if you do use this form, it may take up to 30 days or longer to process the paper form. So we always recommend that employees use SEBB My Account to enroll in supplemental LTD. Just to note that supplemental LTD evidence of insurability will be required as of January 1st, 2021 for late enrollees. So we're talking about those employees that wish to have supplemental LTD outside of open enrollment or outside of their 31-day period, or they don't have an SOE. They will be requiring evidence of insurability, proof of good health. And we will cover more information on this in the next webinar, the SEBB My Account functionality. So there is a webinar that the standard is going to be providing. It's a Zoom webinar about SEBB benefit supplemental LTD or basic LTD. These are the dates that their webinar is going to be held. And again, you can go to that the SEBB Open Enrollment webinar page, and you can register there for these webinars. Like I stated earlier, if employees are unable to attend one of the live webinars, employees can watch the on-demand recorded presentation. So just an overview of everything. Who does this pertain to? Those school employees that are eligible for SEBB benefits, and they can enroll during open enrollment through October 26th and November 23rd, and they can do that in SEBB My Account. Coverage is effective January 1st, and also it's based on your age and pre-disability earnings. Never know when we're going to be disabled or something's going to happen. So this is something good you might want to think about, mostly since there's no evidence of insurability right now. So we're going to get into this section is going to talk about some smart health. So how do I qualify? So employees and their spouses or their state registered domestic partner enrolled in SEBB Medical can participate in smart health, but only the employee enrolled in SEBB Medical coverage can qualify for the smart health wellness incentive, that $125. To qualify for the 125 wellness incentive, all you have to do is go sign in to Smart Health and click Get Started. Take your well-being assessment and earn 800 points. Then you can join and track your activities to earn at least 2,000 total points before your deadline to qualify for the $125 wellness incentive. The incentive remains the same for 2021. And we talked about the deadlines earlier for those employees that have a medical effective date between January and September of next year. Their deadline will be November 30th of 2021 if they are enrolling during open enrollment. And those employees that are enrolling for medical, their SEBB medical effective date is between October and December of 2021. Their deadline is the end of December of next year. So employees waiving medical coverage can still access Smart Health, but will not be eligible for the Smart Health Wellness Incentive. So you can still do the activities. You can still get up to 2,000 points and improve your health by doing all those different activities, but you won't qualify for that Smart Health Wellness Incentive. The 2020 incentive is applied in January 2021 if you qualify and you meet the deadline. So eligible employees must complete the program requirements by their deadline date and be enrolled in SEBB medical coverage the following year. So we're talking about those employees that are currently in a medical plan this year. If they enroll in another medical plan instead of waiving, they must be enrolled in a medical coverage next year, 2021. Employees receive their $125 by the type of medical plan enrolled. So if they're enrolled in any other plan besides a high deductible health plan, the reduction to the subscriber's SEBB medical plan is applied to their deductible. If you're enrolled in a high deductible health plan, it's a one-time deposit into your health savings account. Here's some contact information for Smart Health. It has a Smart Health portal questions. Please contact their customer service at this 1-800 number, or you can email Limeade Monday through Friday from 7 a.m. to 7 p.m. If for some reason you're unable to complete the wellness incentive requirements, please contact Limeade. So we're going to get into SEBB My Account and talk about what you can do and what you can't do, and what happens if your employees have issues trying to log in their account after a year. So how do employees log into SEBB My Account? Again, you can go to the school employees webpage and click on SEBB My Account, the green button at the top right there. It'll direct you to Secure Access Washington. They can enter SAL login information and it'll bring you right into SEBB My Account. For those new employees, you must click Sign Up to create a new SAL account. So employees may use SEBB My Account to enroll or change medical, dental, vision plans. They can also waive SEBB Medical. They can add or remove dependents. They can also upload documents such as their dependent verification documents to prove eligibility. You can attest to the spouse or state registered domestic partner premium surcharge. You can also enroll in supplemental long-term disability. You can access vendor websites to enroll in supplemental coverage such as life, AD&D, and you can subscribe to emails from the SEBB program. So what can employees do in SEBB My Account year-round? They can view coverage information. They can view basic employer paid life and AD&D information. They can also view LTD insurance information, download statement of insurances, view premium surcharge attestations. You can make changes to your tobacco premium surcharge attestation. Also, you can make changes based on qualifying events specific to the SEBB program, those SOEs. Employees may not use SEBB My Account to make address changes. They must go through their benefit administrator. They can make life insurance changes. They can enroll in a medical FSA or DCAP, or they may not enroll in a medical FSA or DCAP. You must go to the Navia benefits website, and they may not make life insurance changes as well. You've got to go to MetLife's website. and they may not change their health savings account contributions. So how can an employee make changes? They can enroll and re-enroll in a medical FSA. They can submit that 2021 medical flexible spending arrangement and DCAP enrollment form to Navia Benefit Solution, or they can enroll on Navia's website. They can change the tax status of a dependent by submitting this form here. They can also change premium deductions to pre or post tax. Submit the premium payment plan election or change form/change form. Also, employees may print a statement of insurance. So when employees are making their elections this year, make sure that you print out what your coverages are for January 1st. It's always a good idea to print out your coverages that you're electing for next year. So employees can get these forms on the SEBB program open enrollment website, or they can contact their BA. And those forms will be available starting October 26th. Trouble logging into SEBB My account? SEBB My account requires that benefit administrator have access management rights in order to do this. So if you're a benefit administrator, you need to make sure you have that box checked. And what that does, it'll allow you to disassociate a subscriber's account. If you don't have that box checked, you're not going to be able to do this. So in order to disassociate a subscriber's account, go ahead and click on the Manage Subscribers, enter the employee information in the search bar there, click Search, verify the employee's information, such as their social security number, their date of birth, check the box next to the employee's name, and then directly underneath that, you'll see a statement saying disassociate the subscriber's account. We've had some users saying, well, I don't see the checkbox. It's not actually a button or anything. It's just if you place your cursor over the disassociate the subscriber's account, it'll allow you to go ahead and select that, which will disassociate the account for the subscriber to be able to log back in again. So need help with SEBB My account? During open enrollment, October 26th through November 23rd, you can call this a 1-800 number here to get help if employees are having problems in SEBB My account. It's also Monday through Friday from 8 to 5 p.m. And it allows help with securing your Access Washington registration. They'll provide you some screen navigation in SEBB My account and uploading documents. So some contact information for your employees. So employees should contact the BA directly for help when it comes to eligibility, enrollment, premium surcharge questions, updating their name, their address, their phone number, adding or removing a dependent, payroll deduction information, and getting paper forms. They should contact the plan directly with help with benefit coverage questions, ID cards, claims, choosing a doctor or dentist. Again, don't ask your dentist, contact the plan. They can contact Health Equity if they have a health savings account or that high deductible health plan with a health savings account. Provided the link here or the phone number. They can contact MetLife for life insurance or AD&D insurance. There's the phone number and their website. Or Navia Benefit Solution when it comes to enrolling or having questions for a medical FSA or DCAP. They can contact the standard insurance company with questions about long-term disability insurance. And they can contact Smart Health Wellness Program here if they have any questions or they're not able to complete or those activities on there, or they're having issues with those activities. You can find websites, phone numbers, and mailing addresses at this link here. Again, that's that SEBB Open Enrollment webpage. Some reminders, tips, and resources. So as a reminder, that SEBB My Account user guide is available. It provides guidance to employees on how to use SEBB My Account, enrolling in benefits, uploading required documents, and much more. So when it comes to dependent verification, this is a reminder that DV Docs is due the same time as other required forms, no later than the 31-day for after the date of eligibility. We're talking about those new employees that have 31 days. They must submit those dependent verification documents within that 31 days. Or if they have a special open enrollment, they must submit those dependent verification documents within that 60 days of creating a special open enrollment. And then during annual open enrollment, they must submit those documents no later than November 23rd. And if they're doing it in SEBB My Account, it must be no later than midnight, November 23rd. So follow up with your employees when dependent verification documents are not submitted by the employee, or they're invalid, illegible, or incomplete. Follow up with your employees and say, hey, we got this document, but it's unreadable, or it's the incorrect document. We need other documents. Do not wait for your employees to get back to you, because they're going to run out of that time period when they're not going to be able to submit those documents. So Fuse tips, another reminder. So when you're include your full details, we're talking about including your SEBB organization within the signature block, like you see the photo right here. We've been getting a lot of fuses, and thank you for those benefit administrators that have been including their SEBB org underneath their name. If you don't include that, we need to figure out which SEBB organization this is coming from. So in order to get into SEBB My Account and help you out. So if you include your SEBB organization underneath your signature there, we'll know exactly which organization to go to help you out with your fuse. If you're submitting information, make sure that we get that first and last name and the full Social Security and the date of birth of that employee that you're inquiring about. Choose the category based on the scenario or question. And please respond within the same fuse or for additional information on the same message. Again, these fuses are auto-assigned to different staff. So if you start another fuse, we won't have the full story of what exactly is happening. So please respond within the same fuse. And we respond to fuses in the order in which they are received. So we do ask that you please do not reply to a fuse once the incident has been resolved. That's just something else we got to go back in there and close out, such as thank you so much, very appreciated, and so on. So if your fuse has been resolved, please do not respond with any of these thank yous or much appreciated. That's just another fuse we're going to have to close out. Please do not share the following information. So the SEBB Division Outreach and Training 1-800 number, please do not share that with your employees. This is for benefit administrators only. Also, the PEB Division Customer Service 1-800 number. This number is only for retirees and COBRA and continuation coverage members only. And then the Outreach and Training Fuse link, please do not share that. We've been getting a few fuses from employees, and I've been directing them back to their BA. Check with your BA because they have access to be able to change a lot of the things you're asking about. And then outreach and training staff email addresses or direct phone numbers, please do not share that with your employees. So resources is for employees and benefit administrators is that school employees webpage. So for PEB, not sure if anybody wants PEB information, but it's here on the left side. For continuation coverage information, it's in the lower left. And for school employees, it's in the center, and any information pertaining to retirees is on the right-hand side of that page. The BA website is a big resource for benefit administrators. Also, outreach and training, you can contact us using our 1-800 number or send us a fuse message. You can sign up for outreach and training notices via GovDelivery. You can do that under Notices and Updates. In the section in the center, just click the Register for GovDelivery. To register for fuse, just click on Find Answers. And in the center of the page, you'll see Register to create an account by registering for fuse. Click on the blue link. And here you can receive and send email messages to outreach and training. You can also upload documents to us. So some of the upcoming webinars that Sarah was talking about is our next webinar is October 23rd. It'll cover a SEBB update webinar, open enrollment information when it comes to SEBB My Account functionality for open enrollment. You can register on the BA website under training schedule. And all those other vendor or carrier websites, open enrollment webinars that I was talking about, we're talking about medical plans, dental plans, additional benefits. You can click on that link and register through the SEBB program open enrollment webpage. So we do record all of our webinars and presentations are posted. So on the BA webpage, you can find recorded webinars at the top, and directly underneath that, click on presentations, and all our presentations will also be posted there. Important websites during open enrollment, that open enrollment SEBB webpage that I was talking about. There's the link. Also, the open enrollment webinar for all the carriers. If you want to participate in their webinars, you can register here on this link here. And the virtual benefit fair, which was open last Friday. Employees can now go in there and start getting information.
All right. Thank you so much, Robert. That was a lot of great information.
It was a lot.
Great job. So just a reminder that today's presentation has already been posted to the BA website. So I did see a few people asking if they could receive another copy. So be sure to go to the BA website, and under training materials, the presentation is posted that we just went over. We did run over on time. So as far as questions go, we are going to go ahead and continue to send in your questions, but we will get back to you this week. We'll start working through them and respond to you most likely via either Fuse, phone, or email. But like I said, we will keep the webinar open for a little bit longer so that you can get your questions in so that we can be sure to go ahead and get them answered later on this week. But thank you so much for participating in today's webinar. We really appreciate it, and I hope you all have a great week ahead of you.